Hey, how are you? I hope you're having a great day. Bursae are small jelly-like fluid-filled sacs lined by a synovial membrane with an inner capillary layer of viscous synovial fluid, which is similar to an egg white. Then the bursae become inflamed. It's called bursitis and is usually a result of injury or repetitive movements. Athletes, gardeners, and carpenters are at a risk of bursitis. The picture of what it looks like in the shoulder when it's inflamed. Trochanteric bursitis is a common condition in fibromyalgia patients. It develops when the bursa in the hip become inflamed. There are two locations of bursae in the hip that may be affected. Our hips are one of the largest and strongest joints in the body. And there goes Lucy. We can jump and handle the impact when we walk. Our hips give us power and stability. They're flexible, and our bursa serve as the cushion we need between the bone and soft tissues. When that area becomes inflamed, we get pain. Pain is our alert that something's wrong, and we're not supposed to ignore it. Bursa is located in the greater trochanter, and the other is located in the iliopsoas bursa, which is located on the inside of the hip and the groin. There are a number of other bursitis conditions found in fibromyalgia, including at the tip of the elbow, but that is less common. The knee at the inside of the leg, and the upper shoulder or upper third of the arm, which isn't usually painful but causes limited movement. Today, our discussion will be about hip bursitis or trochanteric bursitis, the most common bursitis in fibromyalgia. Here we go. Fibromyalgia is recognized by widespread chronic muscle pain, stiffness, fatigue, and tiredness, sleep issues, foggy thinking, headaches, and so much more. Bursitis is limited to a specific area of the body. Our joints move easily and smoothly due to the bursae. Bursitis, however, is often misdiagnosed as hip disease or lower back pain. I would think that neuropathy would be suspect too. It usually occurs between the ages of 30 to 50 years old or in younger athletes. I was 49 or around there. I wasn't diagnosed with fibromyalgia yet. My hip pain was so severe that the slightest touch caused me torment. I wasn't an athlete, a gardener, or a carpenter. So why did I get it? Well, at the time, I was experiencing stiffness and pain in some parts of my body, which I was ignoring because I thought it was just part of getting older. The inflammation, though, in our bursae is our body's natural response to an injury or disease. I was well on my way to full-blown fibromyalgia, a disease, and didn't know it yet. So most likely, this influenced my hip bursitis. But I also think that this was influenced by perhaps my leg length inequality. I've never been told I have that, but I imagine that's a possibility. I am bow legged, and one leg is worse than the other. My family doctor sent me to a neurologist and he didn't find anything. So he sent me to a rheumatologist who diagnosed hip bursitis. It was another year before I got my fibro diagnosis. But the bursitis made it difficult for me to sleep on my side or have my puppies or grandchildren sit next to me because the pain also went down the outside of my legs. Well, my response to that was to put a pillow between my hip and my puppies and my grandbabies. Voila, no more severe sudden pain. Anywho, in the beginning, the pain is intense and sharp, but over time, it tends to spread over a larger area of the hip and becomes more of just a constant deep pain. Well, that rheumatologist gave me injections in both my hips. One didn't hurt at all. The other, well, that was immensely horrible. After that, I didn't want to get another injection ever again. I believe that medication that he put in my hips, though, was either cortisone or a corticosteroid. I'm not sure. It helped, but didn't really cure it. I was told to put a cold pack on my hips to decrease the inflammation, and I did, but I could only handle that for a few minutes at a time. I took ibuprofen and anti-inflammatory medication, but since it didn't go away, I got physical therapy, and that helped a lot. It made me aware of the right movements to do. And she also put heat on my hips. And that was awesome. I'm talking, so this little one thinks I'm talking to him or should be talking to him. So here we go. I know that I've had long periods of time without severe pain in my hips. And then either I move incorrectly or I'm not moving enough, or it just occurs on its own. I don't know. But it will reactivate and become an issue again. I don't like to sleep on my back because my CPAP mask will start to leak. So what I'm doing right now is sleeping more on my tummy, off my hips. That seems to be helping. Having the right pillow is another thing. I've been balling my pillow up to make it a little more comfortable while sleeping on my tummy. And so I don't wake up with a stiff neck or neck pain. I do have a My Pillow, and they're really soft and really comfortable. I really do love it. Do you have this problem? I have the same issue with my feet because of plantar fasciitis. The pain will become tolerable over time, and then suddenly I feel like I've been hit with electricity. Usually that means I've overdone it, most likely. Perhaps it's time to take a little break, but most importantly, I have to listen to my body. Now that I've lost weight, doctors can't blame my feet problem, my hip problems on weight gain. Anywho, I've also experienced a frozen shoulder, TMJ, temporomandibular joint disorder. It was a problem for a long time, so I wore a mouth guard. I used to grind my teeth terrible in my sleep, and even while I was awake. But since I've retired, I notice I don't really grind my teeth in the same way I used to. That's good. I also experience tendonitis in my wrists. Is all of these are common in fibromyalgia. Wondering if any of you have had shoulder bursitis, or knee bursitis, or elbow bursitis, or maybe you have rotator cuff problems. The thing about trochanteric bursitis is that in a healthy individual, the treatment plan may eliminate the inflammation. In fibromyalgia, the condition can become chronic, and that's called greater trochanteric pain syndrome. Researchers used to believe that it was from our hypersensitivity to pain, but inflammation is inflammation, right? But I mean, there's so many things that studies are proving, like our low platelet serotonin and low red blood cell ATP, or adenosine triphosphate, which is an energy carrying molecule within our cells, plus our elevated substance P and nerve growth factor in the cerebrospinal fluid. For years now, studies have shown that we get these inflammatory conditions with fibromyalgia. It's not new. We know that studies have shown that we have inflammation in our brain. So that could explain why we tend to get these inflammatory conditions. It's not uncommon for people with fibromyalgia to have lupus or rheumatoid arthritis or some other inflammatory condition. What do we do? Well, stretching and warming up our joints and muscles are crucial to start our day. So if you have trochanteric bursitis, do you find that stretching is important for your recovery? I think it's all of these little conditions. They don't feel so little at the time, but you put them all together and they make managing fibromyalgia difficult. But one thing at a time, one day at a time is crucial to our success. You learn something. I send you gentle hugs and support. Love you. Trochanteric bursitis. Service we need between the point. Experience and Goldie's begging for food. She's our special child. Low red blood. Iliopsoas. So that could, but I also think it, or corticosteroid. That it was from our I got to put him down. Oh my goodness, it's snowing outside. Whew. So it's not all in our head.